Well, today for our Tech Note session, we are taking a look at the role of medical lab professionals in the health service delivery. In the wake of increased cases of misdiagnosis as a result of fake test results, how can this be mitigated? Could it be the result of the delay in operationalization of the lab scheme of service? How will this improve health service delivery? Our guest today is Mr. Eric Okek, the coordinator, Uganda Medical Laboratory Technology Association. Good morning. Thank you for joining us. And Mr. Emmanuel Nduhura, the executive member, UMLTA. Good morning.
Good morning.
Thank you very much for joining us. Yeah. You people are very responsible for, you know, I get to feel that you are underlooked, you are not appreciated enough, because you are the beginning of me getting the right medication. True. Tests. When I come in there, I have done my own tests, which are physical. I go in the mirror and I look at myself and I look at my eyes and I say, I think I have a fever. And then I come to you. You're the person that is supposed to confirm whether I have a fever or not. And that will be where we start our medication from. That's where we start the treatment process from. But first, let me start with the cases of misdiagnosis. Where are these coming from? What's the problem here? Is it a case of, I don't understand, because you take my blood, you do the tests. Where does this misdiagnosis come from?
Okay, thank you very much, and good morning, viewers. I want to first appreciate all the members of the lab fraternity and the great work you're doing. Please keep it up. A quick one. So the case of there are actually a couple of so many factors. Number one, if you go to most of the health facilities, the smallest lab, the smallest room is the one allocated to the lab. Yeah. So you find, say you're doing a TB microscopy, you have to juggle so many things. And then the other thing is most of these procedures take long. So patients will want the results in a few minutes. And for some reason, that pressure kind of make a professional to compromise. So the other thing is also that it is true that sometimes we're lacking mentorship. Yeah, because of our profession not well structured. So there is lack of institutional memory. So many of these new cadres, new people enter the system are not well mentored.
Do you feel like you are less appreciated in the process, in the service?
Absolutely, absolutely. We are like chefs in the kitchen. We cook, but we're not allowed to meet the guests.
Yeah.
We do the biggest part, and that's why we're here.
To get some pretty waiters to come and meet the guests. And
absolutely.
You guys...
We're here to tell the whole world that we don't only want to be in the kitchen. We want to be appreciated and recognized because we do the biggest part of the job.
So is that the reason why you people are misdiagnosing us? Because you feel you're not appreciated, so you decide, let's misdiagnose these people so that they can notice us?
Well, Mr. David, thank you so much for hosting us, and good morning, viewers. The reason, there are a number of reasons that cause misdiagnosis.
Okay, let's highlight them.
From basic infrastructure in the laboratory that we're talking about.
Mr. Okek has highlighted that.
If you're looking at the laboratory having, for example, in a health center 3 that does not have power, and someone is having to operate with a sunlight microscope, for that matter.
Okay.
The other factor you'd consider or look at is the skill set, the laboratory skill set. We appreciate the training that the laboratory fraternity undertakes to equip the different levels of professionals. But if you look at the lower levels that are mostly affected by the misdiagnosis, they are being manned by professionals that are not even, qualified. You look at lab attendants. Look at the professionals that we call microscopists. These are not catered for within the Allied Health Professionals Council that is meant to regulate the practice of the lab. And these are the ones that are giving services at the lower levels of health center 2s and 3. So you would expect that there is going to be some form of misdiagnosis.
Why do I get a feel that there is, you people are having a bad relationship in the health service, you, the doctors and the nurses? Because you see, when I go to the hospital, or I go to a clinic, or wherever it is that I go to get some attention, my biggest concern is meeting the doctor, and not the lab technician.
Yeah.
But you should be working hand in hand with the doctor to highlight some of these things that are holding your profession back, or the results back. Like if you highlight the fact that, you know, some laboratories, because many laboratories in this country are well equipped, well equipped. At least the one thing I've learned from the few minutes we have been here is none of you is complaining about equipment. It's just a few things like lighting and all that, and these are things that you can clearly talk to the Doctors Association and say, guys, come on.
Well, Mr. David, we appreciate the vigilance and open mind of our patients, because when you look at patients these days, once you go into the hospital and you've seen the doctor is prescribing. We've appreciated the vigilance of some, you know, patients to come in and say, doctor, you've not taken my sample for, you know, testing. Or how about you taking my sample for, you know, a malaria test, now that you're giving me malaria drugs?
Yeah, because it's been a habit change now. That
exactly, and it's from that background that we've been having issues as far as our doctors are concerned, because to them we've tried to engage on how to neutralize the would-be professional supremacy over the other. And the reason we are coming up with a forum to discuss most of the issues that are basically affecting the lab profession, including being sidelined and being underlooked, like Okek said. My colleague Okek said that the lab is looked at as the chef in the kitchen, but does not, you know, serve the meal. And we are saying that we need to be part of the holistic approach towards patient management.
Okay,
First of all, it's not true that we have a bad working relationship with the doctors. No.
It might not be bad, but it doesn't look like it's a very good relationship.
No, it is, except it's a very delicate balance in the healthcare system. We need all the players to come on board to help manage the patient. However, from my understanding is the fact that lab professionals are only employed up to a diploma level in the government scheme of service. So there is always that bit of inferiority complex. So in the scheme of service, a degree holder that studies with a doctor for the first 4 years, because most universities offer a degree in lab for 4 years.
Yeah.
So if these guys were allowed to reason with the doctors, someone with a degree in medical lab reasons with a doctor, trust me, these guys, first of all, they spend the first 2 years together in class, and so they can understand basic anatomy, physiology, so they can reason. And even from medical school, they establish a very good working relationship. So it starts from the training station. These guys only meet in a healthcare setting. So the challenge is it will take time for them to build that rapport, and then there's that wide knowledge gap. And that's why we are coming to say, please, if you are employing a doctor who has a degree, you also need a lab person who has a degree, so that these two have the same level of reasoning, and they can easily get along each other. The inferiority complex bit is always dealt with.
Do you ever sit down with the doctors after, let's say, a certain result has come out? Do you ever sit down with the doctor before he comes face to face with he or she comes face to face with the patient, because you have better knowledge of the results that you are about to give the doctor? You have diagnosed. So do you ever in any situation sit down with the doctor and say, you see, I've just diagnosed this person, but there's something I don't understand here? Or do you, because usually what I see is go and take the test from there, and all I see the results being sent to the doctor. So the communication is a little bit closed.
Well, Mr. David, from the patient management perspective.
Is that how it's supposed to be?
That is how it's supposed to
Okay.
be, and where there is a clear institutional setting that emphasizes discussion. The lab always has a mandate on discussing the laboratory outcomes with the doctor. Our colleagues in practice have, even to some great extent, identified unique cases that doctors have not noticed and shared the same outcomes with the doctor. For example, if the doctor sends you to the lab for a malaria test, but the lab personnel is looking by clearly looking at your, you in a way of being a patient, the lab personnel may be inquisitive enough to do another test, for example, a full hemogram, that would result into you being detected to have anemia.
That's exactly where I was getting at. Yeah. Because when I come to your lab, I've been asked to take a test for malaria, and that's it.
Yeah.
And you're not in any position to ask me to take any other test. So that's the relationship I was saying, that as a lab technician, are you in position to talk to the doctor and tell him, you know what, look here, you sent for a malaria test, but I think let's do these 3 tests just to make sure that we are in the clear.
Yeah.
Because very many times you have people who have been, I had a situation of a person of mine that got tested for over 3 years and was told he was allergic to something. He has an allergic reaction, only to find out after 3 years they had cancer.
Well, what the lab is supposed to do in that particular case is not look at the patient in a way that you've been sent a patient to draw the sample for analysis and that's it. You also have a professional duty to look at the would-be implication of the report that you've generated or from the sample you've analyzed. And if it does not make any clinical meaning, then you are mandated to have a dialogue with the doctor that, look, whereas the clinical presentation of your patient as per the communication of the patient history, I foresee that this may not be the right test you've done.
Okay.
Please, can you include this test? And in most cases, where the test that the lab has recommended is done, usually it is pointing to what could be the cause to the problem.
But also to add on that one quickly, in an organized clinical setting, they do clinical review meetings, and then they also do, let's say, a grand ward round.
Okay.
So in this, like a ward round include nurses, lab staff, and then the doctors. So each person would give an explanation of what they do. In other places, they even do a death audit. If a patient dies at 2 in the night, all the people who are concerned, including the lab, is called to explain what happened. So you can realize, I've worked with doctors, personally I worked with doctors, who really call back and inquire, and you explain to them, and you suggest, and they always take it in good faith.
Okay.
Yeah.
So how do we because there's been very many cases of misdiagnosis. How do we address that? Because if the more cases that are misdiagnosed, the more people are going to have that are falling sick all the time, continuously, the more we're going to have the number of deaths in the country on the rise because of diseases that we could have simply treated. There's one time I was in the western part of Uganda, and there's a certain child, very, very sad. This child died because they were getting painkillers and antimeds, something, yet they had gotten a dog bite. You see, because of cases of misdiagnosis, we are losing precious lives. We could be losing them. I like this saying, we could be losing the president, in the next president of this country. So how do we address that?
Thank you, David. We have to look at the practice in general. We have some cases that do not get to the lab, where we have empirical treatment. From the doctor's point of view, he deems it right to give, a form of some form of prescription or treatment, and that has not only escalated the issues that we are discussing now, but has also resulted into what we call drug resistance. If you look at the current agenda that is in the healthcare sector is the high rise in the number of cases of antimicrobial drug resistance, which we call practically AMR. This is basically due to abuse of the would-be systems, because with empirical treatment, or with treating outside the diagnostic window of having identified the actual cause, is that you're subjecting this patient to a treatment which you're not sure will clear the cause. So it is important that the lab is involved from onset of management of this patient. A proper diagnosis is done prior to initiation of whatever form of treatment that the doctor or clinician deems fit.
Okay. Yeah. Let's go to the expediting, the process of operationalization of lab schemes, of services.
Like I already alluded to before, government previously employed only up to diploma level. Yeah, that's the popular known lab technician. Yeah, but we as concerned professionals and other stakeholders, we kept putting on much pressure, and indeed the government through relevant ministries and stakeholders appreciated the need to put in a new scheme of service. So the new scheme of service was approved and was nearing implementation level. So it takes care of lab professionals starting from as low as laboratory assistant up to a consultancy, a senior consultant in medical lab. So, so we're trying to expedite the process of making it function. We want the relevant implementation bodies and organizations like health hospitals and institutions to put in structure, because they're the ones that draw in the structure and generate the wage bill, so that let's say a regional referral, we say we shall need a microbiologist now in our lab with a master's. Personally, I am a microbiologist. Okay. So in that way, they generate this and then they send it to the ministry, and the ministry take it to the Ministry of Finance and see whether it's and that's where our scheme of service is. Okay. It's at that implementation, but it has been put on a hold for some reason that we really want to follow up. Okay.
Yes, to add on to my colleague, what the scheme of service was seeking to address was a historical injustice in the laboratory profession that only considered training of laboratory personnel or the cadreship up to diploma level. And from a historical background, since the profession started in Uganda in 1929, of course that was during the colonial times, the profession has evolved to accommodate various levels of training that include degree holders, master's degrees, for that matter, as well as PhD level. So the scheme of service had come in to rectify the historical injustices, that to accommodate the current levels of training and expertise. Okay. And it had gone through the entire processes, and we appreciate what our senior colleagues have been doing in as far as attaining that, making the scheme of service functional. Okay. The challenge came in when it had already been communicated as an instruction, and some form of group of people that felt disenfranchised came in to petition the ministry not to apply it, which we feel it is very unfair. It is ideologically wrong, very wrong, to suppress a cadreship that is totally empowered to take up the mantle of the laboratory services. Okay. Yes.
That's okay. That's quite a good explanation. Now we get where you are. Anyway, unfortunately, because of time, we have to let you guys go. But before I let you go, okay, is there anything that you feel you should have said before we let you go?
Yeah. So this we are doing a countrywide mobilization of professionals. Yes. We're going to have a meeting on Monday. Okay. This very Monday, we as lab professionals, we want to sit down and we meet the relevant authorities, and they tell us what is happening, why our scheme of service is not being implemented, why the problem is. Okay. And we are calling upon all the lab professionals from wherever you are, please spare some time on Monday we're meeting at Mulago Hospital Guest House.
Okay.
We're going to iron out where the problem is, and we are going to get back when you have a convincing answer.
Okay, we'll look forward to that.
Yeah.
For me is the fact that the intended emancipation of the laboratory practice is yet to be achieved.
Okay.
And we look forward to achieving this through dialoguing and formulating a discourse around the key areas of laboratory practice that involves all the stakeholders, the Ministry of Health, Public Service, and other relevant structures that exist, in as far as ensuring that the laboratory practice and the laboratory as a profession is emancipated and not seen as if it is discriminated against.
Okay.
If you are alive to the fact that last year we were discussing on what included in the discrimination. We talked of age, sex, what. We are saying that at the moment, laboratory cadreship that has a degree should not be discriminated against, because similar levels of training in the same service sector attract a different pay structure that is different from the lab.
Okay. Okay, thank you very much. The symposium, I've heard of a symposium coming up very soon. Give us some details about that.
Through the organizing committee of the laboratory, Uganda Medical Laboratory Technologies Association, we usually have a conference around November to usually attend to critical issues that
just to look through the year and see some of the challenges you've had and how to address them.
Yeah, and they are not only challenges, but we also look at critical research that our members have undertaken, because we are a body that participates a lot in as far as research and development is concerned.
Okay, thank you very much, Mr. Oric Okek, the coordinator, Uganda Medical Laboratory Technology Association, for joining us this morning, as well as Emmanuel Nduhura, the executive member, UMLTA. Thank you very much for joining us for our Tech Note session, and we hope the best for you. And if you have any results coming out of that symposium and meetings, please do share with us. Next, let's link up to Stephen Mbide. Stephen Mbide is in Wandegea. We'll link up with him a little bit later on. I think he's not yet ready to give us a traffic update. But that's it for our Tech Note session. Morning at 10 TV continues right after this.